Here in Oregon, there are about 1.4 million Oregonians living in rural areas, and access to health care in those areas can be difficult, especially for aging Oregonians. Recently, the Alzheimer's Association Oregon and Southwest Washington chapter received a $2 million grant to expand services and resources and build community alliances in 7 Oregon counties. I sat down with their marketing and communications manager to get the details.
Can you tell me about the unique challenges that rural Oregonians face, specifically when it comes to Alzheimer's and dementia?
Healthcare is a big point of discussion right now, as many of us know. And when you look at rural healthcare, we see a very different picture from what you see in urban centers, where even urban centers, we see a lot of strain and lack of providers. Now imagine those things are significantly more stressed and significantly different in more rural areas. So for example, most older adults are going to be seeing a primary care provider. That provider may be a physician of some kind. That provider may be, some other healthcare professional who's able to step into that role, and they have to be the sole provider, basically. We have a serious staffing shortage of geriatricians. These are the specialists who really focus on older adults. And to give you kind of an idea of that, we would need more than twice the number of geriatricians we have to be able to meet the healthcare demand that there is. And so you've got these providers who basically have to be a neurologist, a geriatrician, and just a specialist around, not just memory, but then everything else too, because there's so many different, health conditions that maybe they're overlapping. And so the providers are stretched really thin. And when they're, when somebody does have access to a provider, when they are trying to get a consult with a specialist, they may end up having to travel great distances. We're looking at somewhere between 1 and 3 hours, depending on where you live, or possibly more, the further east in the state you are.
So when you get into these rural communities, what are you guys doing there?
We work really closely with community partners, and we bring the community together in kind of a listening session. And so our first project really is a lot of outreach and really identifying like who needs to be in the room, who is already doing work. That's a big one, is making sure that we're not coming in as if there are no supports, but really trying to bring folks together, because often in healthcare things are siloed. And so we bring these community partners together. We bring in many different stakeholders who are also business owners, just families, individuals, friends, folks who are part of social networks within the communities. We bring folks together for this listening session. So we're trying to identify what are the gaps, right? So for example, one thing that we hear a lot is the lack of respite. And so respite, just quite simply is, it's a service that helps caregivers and care partners, take a little break and take care of themselves, so they would be able to work with somebody who can help support the person that they're caring for. And these services are really, really hard to find in rural areas. And so we identify things like that. So like, what is the biggest service gap, or what is the biggest resource gap, or what is the biggest knowledge gap? When are people being diagnosed? There's just a lot that goes into it. And so from there, what we do is we work with that listening session. We create a community-specific action plan. So it's not just identifying these things, but now it's actually continuing to meet with these organizations and start following through on how we're going to continue to bridge gaps within this plan. And so from there, then we kind of have this community outline. And then what we really have to do is we have to really kind of promote and inspire like community-based leadership so that these projects can continue. And so a lot of that is going to look like volunteer recruitment. A lot of that's going to look like making sure that we're still there as a central piece for resources and to help continue to keep these communities in conversation with each other around this topic. And then really from there, it's almost like it's a think of it as like a leadership development kind of process, where volunteers are really being taught how to be community leaders so that they can continue to navigate and lead within these communities.
Big thank you to Hudson Tyler for that interview. And for the Alzheimer's Association to continue this work and more, they need volunteers. So if you're interested, go to alz.org, and the association's free 24/7 helpline, 800-272-3900, is a great resource if you have a loved one with Alzheimer's or another type of dementia.